Thank you so much, and thanks for giving me the opportunity to present a bit of my work here in this keynote. And I'll try to give you an overview of what we've done in the past in terms of using network science principles and theories for understanding disease dynamics, and how, at the end of my presentation, we use it now during the COVID-19 pandemic, and how it has helped us understand the dynamics of the current situation a bit better. And so I'm now going to share the screen. Okay, so now you should see like a funky picture with dots in it, which is the intro slide. So essentially, I'm going to give you a little bit of an overview of how we use network science and what we do, and that's only a tiny part of what people are using networks for in the COVID-19 pandemic. So I'm going to start with this video that Hiroki Sayama keeps updating on the internet, and it's essentially sort of a fast version of the dynamics of the COVID-19 pandemic with an initial outbreak in China and the subsequent spread to Europe and the Americas. And this video covers a period of around half a year. And when you watch this video, you can kind of get an idea of what went on and how complicated this spreading phenomenon is on a global scale. And one of the things we're trying to do, oh, here's another video. This is very similar. This is a computer simulation that's a bit has come of age. It's from 2009. It's a simulation we made to describe the spread of the H1N1 pandemic, just to show you that even though these patterns are very different, they also share a number of similarities. You know, here we had an outbreak in Mexico and a subsequent spread to the rest of the world. Now, those are only, I'm going to make you smaller so I can see my screen better. I wonder if I can do that. I'm just going to, okay, that's fine. So, you know, these things that I just showed you are examples of, you know, an increase of events, of outbreaks of either new emergent viruses or viruses that we already know. And there seems to be an increase in events like this. So the COVID pandemic was one, and then if we rewind a few years, we had the Ebola crisis. Just notice that I forgot an A in the little dot here. 2014, we had Zika, another infectious disease that is transmitted by insects in 2015, and the 2009 H1N1 pandemic. So it seems like there are more events like this emerging. And the key question is, of course, what is doing this? And another indication that this is something that is potentially happening at a higher frequency now is that even Hollywood, after the 2009 pandemic, produced 2 films that touch upon this topic. So like maybe some of you have seen the movie Contagion, which is now, again, very popular. And it kind of illustrates what would happen if a virus spreads that is very deadly, you know, what kind of repercussions in terms of economy and social cohesion this would produce. And then there is this other film called The Rise of the Planets of the Apes. And to all of those who have not seen this film yet, this is going to be a spoiler alert. This film is not really about epidemics, but at the end of this film, which is essentially sort of a planet and there are like apes and no humans, and it turns out it's Earth, and the humans have almost all gone extinct. And the story behind this is that the people that made these apes more intelligent also developed a very deadly virus, and that virus infected all the humans and killed them all, and the apes were immune to it or were unaffected by it. And when you watch this film, it's entertaining. At the end of that film, there's a video animation, and it kind of continues the story of this. And there's like this this airline pilot. He's infected with this deadly virus, and he travels and infects new people, and then everything essentially is spread across the worldwide air transportation network. And the people who made this movie made this kind of animation, and it kind of illustrates very well what we saw in the other videos that I showed you earlier, is that you know, that our mobility, our global mobility nowadays generates this very rapid spread of viruses across the globe. And you know, that's one of the factors is mobility. I'll talk about this in a second a little bit more. Another is urbanization, of course. That's one of the reasons why we see more emergent infectious diseases appearing everywhere. Urbanization is just, you know, the fact that now more and more people live in larger and larger cities, whereas, you know, 100 years ago or so, only a fraction of the worldwide population lived in cities. And cities, of course, are conditions where people are very close to one another and interact more frequently. And the direct interaction of individuals is something that causes viruses to spread more effectively, which is, you know, of course, why, you know, all the countries that are now in lockdown in Europe, for instance, target exactly that we're trying to reduce our contacts, because the contacts are the food for the virus. And when you look at the urbanization, starting in 2008, more than 50% of humanity lived in cities or large giant cities worldwide. And in 2050, it's going to be even more, 64%. And when you wind back a little bit, in the 1800s, it was only, you know, less than 10% that lived in cities. And in 1900, only 100 years ago, it was 17%. So everything is getting more concentrated. And the next thing that one has to take into consideration is that even in these urban settings, humans and animals are interacting. Like, we eat meat, and in many of these big cities, there's a direct contact between livestock and humans. And many of these viruses that emerge are coming from animal populations, where they can spread and potentially do not even affect the, you know, the animal host. But when they make the transition to humans, that spillover, they're not adapted to the host, and then they, you know, make the host sick and kill the host even. So that's another reason. And third, this is something that I mentioned just earlier, is our mobility. This is the Worldwide Mobility Network. This kind of structure has been analyzed in network science, I don't know, like since like 20 years ago, people started looking at this. And it's kind of the backbone on which everything spreads nowadays. And just to look at a few numbers to get sort of an intuition about what kind of network this is, we have about 4,000 airports worldwide, and there are like 50,000 direct connections between airports. About a little more than 3 billion passengers that travel every year on this structure under normal conditions. And humanity travels about 14 billion kilometers every day. And just to get an idea of what that number means, it's about 3 times the radius of our solar system, so the distance between the sun and Neptune. So that's what we travel on this network every day. And of course, that has an impact on how diseases spread. Now, let me talk a little bit about the types of networks, just to clarify. I mean, all of you are interested in networks, and this is a slide I usually show to people who have never seen networks before. In all the models that are concerned with disease dynamics, there are structurally essentially 2 different types of networks that are involved. Now, I'll only talk about one. In one network, like the air transportation network, the nodes are locations, and the coupling, the links, typically weighted links, quantify the, you know, how many people go between, you know, this airport and another airport, or, you know, other means of transportation, you know, if you look at a different mobility or transportation network. And then there are the networks that also play a role in which the nodes are individuals and the links quantify to some extent how likely two individuals are to interact directly by contact or by physical proximity. I'll only talk about on the left types of networks, like this one, the air transportation network. It's just another image of it, which illustrates how connected we are. And I'll just skip this because I'm not going to talk about it today. Now, in order to make this simple and kind of focus on the essentials of modeling disease dynamics, and I'll talk later a little bit more about like what kind of flavors of models exist. If you make a very simple, so very cartoon-like model of a contagion process, we could think about a lattice, for instance, where individual lattice can be infected and susceptible or immune, and then they can just transmit the disease to neighboring lattice sites with a certain probability. What naturally emerges if we do this with local coupling, we see generically a propagating wave. Where we have an initial seed, and then the disease transmission propagates to the vicinity. And now I'm just showing you this very simple picture because there's something we can learn from it. If we have a phenomenon like this, we could just, if we're the little green dot, and there's the outbreak location is the red dot, we could just empirically measure the wavefront speed and then predict when that wave is going to hit us. So that's some sort of information we could gain from this simple wave-like pattern. And that's what people do also when they observe wave-like patterns. And, compare, looking at this, this constant speed propagating wave, we see this sort of behavior also in a number of natural and social phenomena. One of them, at least approximately, is the spread of the Black Death in the 14th century, which propagated in this wave-like fashion at a speed of a few kilometers every day, in the time course of a few years from Southern Europe all the way to Scandinavia. And in fact, in a number of publications, older publications, this kind of wave propagation was used in order to estimate disease-specific parameters of the Black Death in the 14th century. Now, if you look at this video again, I'm going to compare it to another video, which is just a model that is also just as simple. We have pixels and they infect one another locally. But in addition to that, we have also long-range infections. So with this tiny probability on the right, in the right video, an infected pixel can infect a very remote pixel. And as you expect, the pattern looks more complicated because new kind of hot zones can be initiated or seeded somewhere in the structure. And I'm just showing this to you not because I want to show you something that would be surprising, but something that we can learn something from. If you look at the right picture and you're located somewhere in this pattern on this, square lattice, it's very difficult to predict actually when an epidemic wave will hit you, because you cannot predict if there is a local seed seeded somewhere near you. So just by this tiny little dynamic ingredient that there's long-range mobility, the pattern becomes spatially more incoherent, and therefore just by empirical methods have much more difficult to predict. And that's a loss of predictability in disease dynamics in a sense. So which, what I illustrated in this cartoon-like model is also, of course, true in reality. When you look at the actual spread, I could have shown you the video that Hiroki did for the spread of COVID. It's just spatially a lot more incoherent, just like what you see in the computer simulation of H1N1 in this video. So, but is that really so bad? Well, we could, because we do have big computers now. We can design models which work a lot like the sort of idealized two-dimensional lattice model that I just showed you, except for it uses the worldwide air transportation network as a backbone. So you have all these places worldwide coupled in a certain way. And in every one, there's some sort of epidemic dynamic happening. But the way these different places are coupled together is governed by the air transportation network. So this network becomes a mediator of the disease. And there are various ways of doing this. But when you look at all the models that exist that do it, they kind of follow the same structure, that the mobility networks, they govern how likely a transmission from one location to the other is, and then it's just a matter of details and putting this model into a computer and letting it rip. And then mostly, all the ones that are used for real-time forecasts or like realistic forecasts, they use a certain degree of detail and stochasticity, but at the end of the day, the backbone of all of these models is the Worldwide Air Transportation Network, if you want to answer questions on that kind of scale. So that's how that works. And one of the things that everyone knows is that when, regardless of what kind of model you look at, because of the complexity of these mobility networks, in this case, the Worldwide Air Transportation Network, geographic distance, obviously, to an outbreak location is no longer a good predictor of when an epidemic wave will hit you. And so there's like some data in this figure that you see here for H1N1 and SARS, which is just a scatter plot of the geographic distance to the outbreak location and the arrival time of the epidemic in your location. And there's some correlation, but essentially it's a cloud. So geographic distance no longer is a predictor for arrival time. So that's kind of expected. And because we can no longer use sort of just plain geography in order to say something about arrival times, one philosophy is to, because we have very powerful computers, is to develop these computational frameworks like GLEAM, the Global Epidemic and Mobility System, developed by Alex Vespignani's group years ago, and Vittoria Kolitsa and many others contributed to this. And it's a wonderful tool, actually. It's a simulation framework that incorporates a lot of detail, transportation by air, but also commuter traffic, a lot of information about specific cities, like, just a few things. I'm showing here, like, what the concentration of hospital beds is, which is an issue now, as we know from a number of countries, that intensive care units are filling up now in the second wave, etc. So all of this can be incorporated in principle in these very sophisticated and detailed computational frameworks that are then used to make predictions about the burden of disease or the spread of a new virus. But with models that we do, and also other colleagues do, there's always an issue. And I want to focus not so much on the success of these models, but rather also on the issues that are involved in these kind of mechanistic models that describe how disease dynamics unfolds in realistic settings. And one of the issues is, this is a pretty old slide. It shows outbreaks that are fairly aged now, but I can explain the principle using those. One of the things that modelers are always confronted with is that even though there are many models that seem to be working quite well in terms of like describing the actual spread of an epidemic, when there's a new outbreak like COVID in Wuhan, usually in the beginning, if it's a new virus, we know little about the virus. We know little about how long people are infectious, what the recovery rate is, what the reproduction ratio, and other disease-specific parameters are. And also, we don't know so much about the initial conditions in terms of, where's the outbreak, how many people are there, etc., because it requires testing, So when we need these models most, that is during the initial outbreak, in order to, make a forecast about what other countries are going to be affected, etc., we don't know much about the initial conditions and the parameters in the situations we need these models most. And there's another issue, and specifically and especially for models that incorporate a lot of detail. So these are two images. They're also more, almost like 15 years old, but these were some of the first very fine-grained agent-based models on hypothetical pandemic events in Thailand and in the United States. And they do contain a lot of detail, and they both were published in Nature. One was a letter, one was an article, and essentially they're both identical, except for the countries are different, and all the fine-grained information about the countries is different. And I always show this because when I teach to my students, I give them these two examples. This is a 5-page and a 4-page paper. But if you look at the PDF of the papers and you count the word assume, in each one of them, you get an assume count. I call this the assume count of 17 and 18 in each of these papers. So what that means is that there are lots of assumptions in there. And these are not assumptions like abstractions. We assume like humans are particles that interact, but rather assumptions like we're going to assume the contact rate of people in the age bracket 10 to 15 and those in the age bracket of 65 to 75 is this. So there are actual numbers in these models that one has to assume, and there's often very little evidence of what a particular value should be. And because these models are so complicated, it's very difficult to test their structural stability. By this, I mean that you cannot test in a systematic way how stable the predictions are with respect to changes in the parameters. And so that's another issue and a problem, I think. And I'm not the only one who thinks this. There's like also a quite old paper by Bob May, who used to be a pioneer in mathematical and computational epidemiology, among other things. Also, he was he had countless high impact papers about, ecological networks and other things, or chaotic dynamics. And he recently passed away, which is very sad. But he wrote, also a physicist by training, he wrote a couple of years ago this paper, and I advise everyone to read it. It's called Uses and Abuses of Mathematics in Biology. And in it, he says, which I cannot read because now your faces are covering this. I'm going to push you here up. The increasing speed and sophistication and ease of use of computers enables an increasingly large number of life scientists who have no substantial background in mathematics to explore mathematical models and draw conclusions about them. It's a fairly neutral statement still. Let me go back once. Such activity usually consists of representing sensible and evidence-based assumptions as the starting point for a complicated and usually nonlinear dynamical system, assigning particular parameters, often in an arbitrary way, and then letting this complicated system rip. We arguably are seeing an increasingly large body of work in which sweeping conclusions, emergent phenomena, are drawn from the alleged working of a mathematical model without clear understanding of what is actually going on. I think this can be worrying. And so I'm showing this to you not to condemn computational models per se, but I think it's very important what he says, in the sense that it's always good to also keep things as simple as you can, if you can, and to understand what is actually happening in your computer when you design a simulation. Now, having said this, I want to tell you a little bit about an idea we also had now like seven years ago, a while back actually, and how this idea helped us better understand the spread of diseases on a global scale. And it's all focused on a different perspective. And when let me show you this video again. So in this whole topic of disease dynamics, especially spatial disease dynamics, what we usually do is we look at maps. And we color the countries according to case counts, etc. It could be a world map like this one. It could be a map for Europe or for the United States. but we are very used to seeing maps. And the reason why we're used to seeing maps is because geographic distance in our head is meaningful. Also, national borders, at least to some people, are quite meaningful. And so when we look at this, in this traditional view, what we see looks spatially incoherent. And it makes sense because everything is coupled by this funky, highly complicated air transportation network. But what if we look at this whole process from the perspective of the virus? So the virus, if we talk about a virus, is a very passive agent. It sits and replicates in an individual, but other than that, it's quite passive and it just gets transmitted to another person. So if we are a virus on a host in, say, New York at an airport, let's think about this in terms of the air transportation network. We're much more likely to end up in London and Frankfurt, even though these places are very far away, than in Pittsburgh or Raleigh-Durham, because there's from JFK more traffic to London or Frankfurt. And so in a sense, qualitatively at least, the virus perceives London much closer than Frankfurt. And so the idea behind this paper we did way back is to introduce a concept of effective distance, which is related to the likelihood of someone going from one location to the next. There's not a unique way of doing this, and we tried one in which we used a relationship that you see in this equation, which is related to random walk theory. So where we have a probability of going from one node to another, and we have in a multiple step path a product of probabilities, and we wanted to have distances, effective distances that are additive. And so that's why this logarithm appears in there. But it's not really essential for understanding the gist of this. What you need to understand is that if there's lots of traffic, usually there's a shorter distance compared to longer effective distances between locations that are coupled weakly. And so when you do this, you can go on, you can take your network and then you can ask, from a node to another node, there's some sort of shortest path. There are multiple paths from A to B. And we can compute the shortest path using this effective distance. And you can compute the shortest path from every node to every other node. And what you get is something that I want to show you now in the browser. Now you should see this air transportation network because I stopped the presentation. And if I pick, say, my location, which is TXL, which is Berlin Airport, the old Berlin Airport. It's a location here. And this is the traditional view that you see now. And now I can redesign this and I'll make it circular and have now a new representation where Tegel, Berlin, is in the center. And this radial distance here represents this effective distance. And this tree is the shortest path using this effective distance. And you can see Frankfurt is quite close. And so is Istanbul, but also Beijing is not far away, or Singapore, or some other places like Newark. And you can go back and you could, in principle, now take, say, Wuhan, which was relevant during the initial outbreak, just right here in the middle of China. And you could produce the closest, this effective distance representation from the perspective of Wuhan. And you see Beijing is quite close, but so is Rome, Charles de Gaulle, and London. And you can see some of these airports in Europe are then entry points on which the virus can spread, for instance, to Italy. Now going back to this, to my presentation, I have to push you aside again. So that's the general idea. Let's replace a geographic distance by this effective notion of distance. And you can see for every airport on this network, you can see a representation like this. But what does that really mean in addition to being more intuitive in terms of telling you effective distances? When you run simulations, computer simulations on hypothetical pandemics like the ones that you see here, on the top is a spread that started, hypothetical pandemic that started in Atlanta in the US, and on the bottom is a hypothetical pandemic that started on a Greek island. You can see in the traditional maps, it's again spatially incoherent, whereas in this effective distance representation on the left, it's the same simulation, it looks like a propagating wave. And so that's good because it means that if I don't need to compute anything or run a simulation in order to make this representation. And once I've got it and I see a spreading phenomenon in this representation, I can measure the speed again, and that gives me an estimate on when an epidemic is going to arrive at my location. And in fact, when I do this, this is a picture that I showed you earlier where I correlated geographic distance to the outbreak location to arrival time. And when I just replace the geographic distance with this effective distance, which is a purely topological feature of the network, I get a much better correlation. So that's what makes it better in terms of predicting arrival times. And one of the things that we did is apply this to the during this spring when there was the outbreak in Wuhan and then spread within China, and we tried to compute the most probable spreading routes using this approach and arrival times in different countries. For instance, here you see the route again, the tree from Wuhan. Here you see a tree that is based, I can't see it at the moment. Oops, let me go back. I have to move you a little bit. This is Beijing. Oh yeah, it says on the top. And here, this is a linear representation where now vertical distance means effective distance. And when we do this, and we did this in the beginning, we computed the import risk using this model during a situation when we only had cases in China. And based on this import risk, we used also expected arrival time, computed sort of the spreading wave pattern. And then this was then later confirmed, essentially the sequence of arrivals in different countries worldwide with this bit of variation, of course. Now, another thing that is, all of the things that I've said are concerned with the global picture of stuff. But I can assure you that being in Berlin, where, which is now a COVID hot zone, everything is also about local mobility and how people move around in the city or on an intermediate scale in the country. So one of the things that we've been trying to do is using data that is collected, positioning data that is collected by cell phones, because everyone has a machine like this. And during the initial outbreak, a number of phone companies approached my institute, which is the Public Health Institute in Germany, about donating aggregated and anonymized data on cell phones. One of the things that we had done previously with this sort of data is trying to understand a bit the structure of mobility of people that live in a city like Berlin. And I want to show you a project just because it's very beautiful, I think, that a student of mine did, who is now a postdoc. He took my Google location data, the Google, what is it called, timeline or whatever it's called, that has been collecting my mobility for the past years. And Benjamin, my postdoc, took this data and visualized it. So this is Berlin, and you can see where I live. It says home, and where I work. And all the bright areas are where I am as a function of time, aggregated over time. And one of the beautiful things that Ben did was, I'm going to show you in the browser again. He kind of wanted to understand this. Let me remove this a little bit. Here we go. He wanted to understand mobility patterns in an urban setting. So one of the things that you see here, or the thing that you see here, let me turn this off. Nope, I'm sorry. This. So this is Ben's This is Berlin, and this is Ben's aggregated mobility information. And the bright red areas are places where he spends a lot of time. And the dark red areas are areas, parts of the city where he spends little time. And when you look at this data, you can even, on the top right, you see now a clock. You can see that this varies periodically over time. So his days essentially look the same. But again, this kind of flashing doesn't tell you so much. But what you can do is, let me turn this on. You can use what is called density equalization, where you blow up the areas where a person spends a lot of time, proportionally to how much time they spend there, and where you shrink the areas where the person spends very little time. And when you then play this as a function of time, it looks like this. So this is Ben's, we call this Heart of Berlin because it beats like a heart almost. It's very beautiful, I think. And before COVID, we wanted to kick off actually a website where you can donate your Google timeline data and where then everyone can compute their Heart of Berlin, all the people that live in Berlin. They look a little different for each person, but they all share this pulsing behavior because people live in some place and they work in a different place. So there's high regularity in these mobility patterns, and you can make beautiful pictures with them. I just wanted to share this with you because I thought it was very beautiful. Coming back to the talk. So that was sort of a fun project that Ben did, and I thought it was very intriguing and artistic. On coming back to reality, one of the things that we wanted to do is, like, once the virus came to Germany, it was clear that this thing would go off in spring, and we wanted to see if we could use information about mobility that will tell us something about the disease. So almost all mobile phone companies gave us aggregated and anonymized data, which is essentially how many people go between one county and another county in Germany. There are about like 300 such little geographically coherent patches in Germany, and you can compute an aggregated network. But that network is time resolved. So you can look at this network in the morning or at noon or in the evening, but it is aggregated geographically. And one of the things that we set up is this COVID-19. It says 10. That's wrong. You can see that in the header it says COVID-10 mobility. It's wrong, COVID-19 mobility. So if you want to go to the website, you can try it in parallel to the talk. And there, all this data is displayed on how mobility changed from, for every day from February until now. And one of the things that we try to understand is the impact of the lockdown on mobility. And when we looked at these weeks 11, 12, and 13 in March, we could see that, like, the yellow is here pretty much normal, and then the lockdown happened in week 12 and 13, and it essentially froze the country in terms of mobility, but not in a homogeneous way. I'm sorry about how low quality this picture is. I just copied it out of a paper and didn't pay much attention. It's from a PNS article that is about to appear that Frank Schlosser, a coworker of mine, did. And he looked at this mobility overall, and what you see in this figure is how the mobility decreased in mid-March from a baseline to about minus 40%. And these red bars that you see are lockdown measures that were put in place politically. And then it relaxed back to normal, and the green lines are sort of lockdown release measures put in place by politicians. But you can see it moved already back in the return direction before these measures were in effect. And then by the end of June, everything was back to normal. And it depended also a bit on distance. So people didn't, reduced mostly their long distance traffic and not so much their local mobility. One of the interesting things that we found, I apologize that this slide is in German because it was made for the people at the German government and they don't speak English, I have to say. Oh, this is being recorded. I have to be very careful about what I say. But so what this says is change of mobility, and it is compared to a psychological quantity. It's a collaboration with a public health psychologist that is very prominent in Germany, and she does these surveys. And she asks, how valid do you think the restrictive measures politically are? And or how in what way are they too strong? And when she measured this curve changed as a function of time, and it coincided very strongly with the mobility, especially the increase in mid-March could not have been affected by any political measures because there were none. And so we continue to see that the mobility change is very, very strongly linked to the risk perception of individuals, which is the key feature here. And another thing that we saw, we also looked at these shortest path trees using effective distance, because they, like, according to what I showed you earlier, give you a good prediction about arrival times if there's like an outbreak. And the structure of these showed a massive change in the nature of the mobility network in Germany. It became from sort of a multi-scale kind of network more lattice-like, because mostly all the long-range traffic was gone. And that would have had an impact on the disease dynamics. This is just a comparison how two diseases spread on the pre-lockdown and the lockdown network. It's mostly for illustrative purposes in order to see how much mobility restrictions mitigate the spread of a disease, but of course only in situations where you actually look at a spread and not in a sort of a situation where case counts are everywhere. And so with that, I'd like to thank you for your attention, and I hope you've learned something, and I'm ready to take your questions.